Hi, this is Shelley Kraft, and welcome to SNNLive. We're at the AdvaMed Conference 2011, the MedTech Conference in Washington, D.C. I'm here with Dr. Larry Mahan, actually a PhD, who is from the Children's National Medical Center, a private nonprofit hospital. You know what? Welcome to SNNLive.
Glad to be here. Thank you very much.
Now, tell me everything. Because I know there's a lot.
Well, first I'll tell you a little bit about Children's. It's the Washington region's primary pediatric care hospital, many specialties including oncology, neurology. It's a 300-plus bed hospital, really one of the nation's best.
Good. Now, what's going on? I know that there's been some developments over the course of the last year. I'd like you to share that with our audience, please.
Well, two of the things we have are, we have a new CEO, Dr. Kurt Newman, who has been with Children's for 20-plus years, surgeon, and he, over in his prior incarnation as head of surgery, initiated an innovation initiative, of which was one of the reasons I was brought on, which I'm very happy to say. And it was initiated itself by a $150 million gift from a philanthropic gesture from the government of Abu Dhabi to create a brand new Institute for Pediatric Surgical Innovation. So it's called the Sheikh Zayed Institute for Pediatric Surgical Innovation in honor of the Crown Prince's father who founded the UAE. And the mission is to make surgery more precise, less invasive, and pain-free. It's a wonderfully new initiative. We're very proud of it, and we've started hiring faculty. We have a new vice president who came from Toronto Hospitals for Sick Children, and about 40 staff in place now in 22,000 square feet. So we're rolling.
So rubber is meeting the road, so to speak. So what's your job there?
So my position is new in this kind of hospital academic research setting. I'm the Director of Innovation and Business Development. My job is to work with the researchers and clinicians on their new ideas for products or diagnostics or procedures, devices, and put sort of that company development reality to that and try and move these through internally with the idea in mind of partnering with industry, and that's why I'm at the conference this week, partnering with industry to see these developed. Our goal is to take children's national innovation and get it as soon as we can into practical pediatric care. So that is a bit of a mind change for researchers and clinicians. They always have great ideas, but those ideas have to be tempered with the reality of, is there a market? What does it look like when it's on the market? And how do we get there? And what regulatory considerations and intellectual property considerations have to be looked at to really judge the reality and the value of it, so that when we go to hand that over to an industry partner, we're giving them the best valued proposition we can, and hopefully expediting the product development for them and creating value for them, but getting it into care as fast as possible.
Your motives are wonderful. It's not about how much money you can make in the shortest period of time, yada, yada.
Yeah. Well, we're always looking. We're investing dollars, time, and effort, so we do want to look at the possibility of return, but return for us is many things. Return is seeing that child who I get on the elevator with in the morning, who's 3 years old and maybe in a wheelchair or sick or sometimes well, and deceivingly, you don't know what may or may not be wrong with them. Seeing them leave the hospital well, seeing that family happy. That's one. Having a children's brand to that innovation, thinking that we've contributed by our research work, by products we can help get into practice, that's another. The long-term sustainability of the Institute, yes, we do look at financial return. We consider that as well. So it's really a multifaceted look, but the patients first, the family is right there with them. Our excellence of service is right there after that. the rest is gravy.
And I like the interaction between the United Arab Emirates and a U.S.-based hospital facility. I think that's a good grounds for relationship for years.
Yes, and our foundation has been working with the Crown Prince and the Ambassador for a number of years now along the lines of executing this gift. We have very certain deliverables that we are in the progress of helping them with in terms of pediatric care in the UAE. We're looking at, they have critical issues in obesity and diabetes. These are two areas that we have strengths in terms of our clinical strengths. So
those dates.
So yeah, and soft drinks and fruit drinks, and so we're really trying to assist them with their pediatric needs on site in the UAE. We make a number of trips back and forth, our clinicians and researchers, to try and help them on their end as well.
Well, I have to thank you for coming on to SNNLive. Lawrence Mahan, PhD. Let me get your website immediately.
www.childrensnational.org.
And ladies and gentlemen, Children's National Medical Center. For more information, give them a call. Thank you so much for coming on to SNNLive.
Thank you.
I appreciate it.